Robert Leggett wasn't sure what was happening to him.
I woke up one morning with the wonderful symptoms of indigestion with a pain down my left arm. And so I went to the hospital. They immediately put me in.
Richard Simard thought he was too young to have heart disease, but he knew something was wrong.
I actually just was kneeled down and stood up. And when I stood up and inhaled, it's right then and there that I felt like I had a 98-mile-an-hour fastball thrown at my chest. And it hurt pretty bad.
What Robert and Richard both experienced were heart attacks caused by coronary artery disease. The diagnosis took them completely by surprise.
Coronary artery disease is often a silent disease. About half the people who have coronary artery disease have as their very first symptom of a problem either a heart attack or sudden cardiac death.
Fortunately for each man, a heart attack wasn't the end of the story. It was the beginning of a new life. Welcome to Healthy Body, Healthy Mind. I'm Dr. Perry Kritschmar. Heart disease is the #1 killer of both men and women in the United States. But if you know your risk and you're aware of the symptoms, you can avoid falling victim to this devastating disease. 58-year-old Robert Leggett loves his daily walks through the mountains behind his home. Walking is important to Robert, not just because of the scenery, but it's what's helping him get his health back after coronary bypass surgery 2 years ago.
You can reverse things. You can get back into shape. I feel great.
Richard Simard was only 37 years old when he had his heart attack. Not only didn't he know he had heart disease, he thought he was in excellent health.
Before the heart attack, I was doing 10 to 15 miles every other day on a road bike and didn't feel much. Now I do know the difference.
A heart attack is caused by a sudden blockage in one of the arteries that feed oxygen and nutrients to the heart muscle. The arteries are called coronary arteries, and the disease that led to Richard's heart attack is called coronary artery disease. Coronary artery disease results from a buildup of fatty deposits called plaque. The plaque builds up and then narrows the arteries. A heart attack occurs when the plaque ruptures and a blood clot closes off blood supply and oxygen to the heart. Traditional risk factors for heart disease are hypertension, smoking, high cholesterol, or a family history. These risk factors contribute to the buildup of plaque, but nearly half the patients who have heart attacks do not have the traditional risk factors.
Sometimes it can be fairly straightforward. Traditional risk factors, smoking, high blood pressure, diabetes. Other times it can be much more complex.
I started walking up a little hill there and got about 4 houses up and began to have some indigestion, quote unquote. So I thought it was because I moved to a new location, right? It had nothing to do with my heart. I was in good shape.
That's a complicated
Coronary artery disease can produce symptoms because the plaque buildup in the artery cuts down the blood supply. Like Robert, the only time that became apparent was with exercise or emotion. During exercise, the narrowed artery loses its ability to provide adequate nutrients to the heart. The discomfort that Robert had was called angina, and because it's predictable and stable, it's called stable angina. A much more ominous type of angina is one that occurs at rest. In this setting, the patient develops discomfort without any provocation, such as exercise or emotional upset. This condition is called unstable angina, or acute coronary syndrome.
So acute coronary syndrome is a syndrome which is characterized by discomfort in the chest that comes on without any particular precipitating factor, or the new onset of chest discomfort or symptoms of coronary artery disease when you didn't have a problem at all. For example, somebody might be able to walk up a flight of stairs or jog a mile and have no discomfort at all, whereas they'll go out one day and suddenly they'll walk 2 or 3 blocks and they're very short of breath, or they get tightness or pressure in their chest. They have to stop and the discomfort goes away. Something is unstable.
What's happened is the plaque has changed its character. fatty deposits and material in the plaque have become inflamed, and this inflammation has caused the plaque to swell and rupture. The ruptured plaque causes a blood clot to form, blocking blood flow in the artery. Sometimes the blood clot dissolves, restoring blood flow, and the chest discomfort goes away. If the clot does not dissolve, the total lack of blood flow causes heart muscle to die, and a heart attack results. If the blood flow isn't restored within a matter of minutes, the patient can die or suffer long-term consequences. And here's an amazing fact. Some patients can have heart attacks and not even know it. We'll talk more about that in a minute. But first, here's today's Healthy Body, Healthy Mind Did You Know? Did you know calling 911 is almost always the fastest way to get life-saving treatment? Paramedics can begin treatment when they arrive, up to an hour sooner than if someone gets to the hospital by car. The staff are also trained to revive someone whose heart has stopped. For more health-related information, visit our website at healthybodyhealthymind.com. How is it that you can have a heart attack and not know it? Well, sometimes the symptoms shout, and sometimes they whisper. Here's Julie Donaldson with more.
A heart attack can occur without any warning, but often warning signs do exist that indicate coronary artery disease is present. At age 53, Jerry Laxton didn't think she was at risk, but a nagging discomfort got her attention.
On a weekend when my husband and I would take a simple walk around the neighborhood, I would get the pain around my collarbone, but also across my shoulder blades. And as we developed throughout the month, the pain would radiate down both of my arms to my elbows. Now, everybody's always heard that pain in your left arm is just classic heart disease.
Pain in the left arm can be a classic heart disease symptom, but others are more subtle, like discomfort in the center of the chest that may be described by patients as pressure, aching or burning, or indigestion. The discomfort can radiate into the arms or jaw. Shortness of breath that develops suddenly may also indicate a form of angina. Women more often than men will experience these unusual symptoms or develop a new onset of profound fatigue that signals coronary artery disease.
So the fact that you don't get classical chest pain doesn't mean you don't have heart disease. Many times I'll have a patient who will say, I had a twinge of discomfort, and kind of dismiss it. And it isn't always the severity of symptoms that correlates with the severity of the problem.
One of the difficulties with heart disease is nobody wants to have it. So when they get discomfort in their chest, they want to blame it on everything else but their heart. More people die from indigestion every year than any other problem, because they blow off the discomfort that they're having as indigestion.
Patients are at a greater risk for developing coronary artery disease if they smoke, have high blood pressure, or elevated cholesterol. There are two main types of cholesterol: LDL, also known as the bad cholesterol, and HDL, known as the good cholesterol. LDL cholesterol should be lower than 130. In patients with diabetes or a previous heart attack, or who are at risk for any other reason, LDL should be below 100. HDL, the good cholesterol, should be above 40. And in general, the higher, the better. A third type of fatty substance in the blood is called triglyceride, and this also increases the risk for coronary artery disease. Another important risk factor is a sedentary lifestyle. A lack of exercise provides the same risks as having a high cholesterol level. And being obese raises the risk for coronary artery disease. Obesity is defined as being 30% or more above the ideal body weight. While not considered risk factors, if patients have diabetes, blocked arteries to the legs, or a disease of the arteries to the brain, physicians assume these patients already have coronary artery disease. Robert Leggett had several important risk factors. He smoked for 30 years, and he had a strong family history.
On both sides of the family, there were heart problems. In fact, my dad had two brothers and a sister. The oldest one lived to be 58. All died of heart attacks, including my aunt. On my mother's side, she had 3 brothers. One died of cancer at an early age, the other 2 died of heart attacks, and one lived to be 63.
It's important to remember family history is only a significant risk factor. If a close family member, a mother, father, aunt, sister, or brother had heart disease before a certain age, 45 for men and 55 for women. Not everyone experiencing a heart attack has the traditional risk factors. Researchers have discovered new factors that appear to be linked to increased risk. The most heralded breakthrough is a better understanding of the inflammation inside the plaque that leads to the heart attack. Researchers have found markers of inflammation that may be just as important as the cholesterol level or blood pressure reading.
Historically, cardiologists viewed coronary disease as almost like a plumbing problem. If there was a blockage, it interfered with blood flow. But now we know that heart attacks, angina, other vascular symptoms are really due to problems with inflammation inside the blood vessels.
One marker of inflammation, the C-reactive protein, or CRP, is a protein made by the liver that becomes elevated when inflammation occurs in the body. Research suggests that CRP itself may be an agent that damages the artery. High CRP levels may be an extremely significant risk factor for determining when patients are most likely to have a heart attack. Another marker of inflammation called interleukin-6 may also be a powerful predictor of coronary artery disease. Both CRP and interleukin-6 may give doctors more insight about who's at risk and more options for their patients.
They may be the most important predictors of whether or not you're going to have a heart attack, even more important than cholesterol levels or even family history. So these kinds of markers may tell us which patients will benefit from certain kinds of therapy. In other words, somebody who's got a lot of evidence of inflammation in their body may be somebody that we want to treat differently than somebody who doesn't have that problem.
Emotional behavior can also precipitate a coronary event. Cynical, hostile people given to expressing free-floating anger tend to have a much higher risk of coronary events. Whatever the risk profile, if there are any symptoms of coronary artery disease, it's important to seek medical attention right away. When Richard went into the emergency room with the classic symptoms of a heart attack, chest pain, tightness, and shortness of breath, it was clear that he was in grave danger. He was placed on a cardiac monitor, given aspirin, a blood thinner called heparin, and nitroglycerin. He was also given medication to reduce the stress on his heart. His electrocardiogram did not show any damage. His doctors took a blood sample to look for any elevation in cardiac enzymes that would indicate any heart damage.
After the second set of tests came back, I was informed that I was borderline, and I did not want to have the angiogram. It was I thought I could get by without it. And the third set of tests came back, and the doctor made up my mind for me and gave me an ultimatum. This is what needs to happen. So I really had no choice at that point.
His doctors recommended that he have a coronary angiogram, an X-ray procedure that shows the coronary arteries and provides a roadmap of where and how severely the coronary arteries are blocked.
Coronary angiography is the diagnostic portion of the studies that we do that define coronary anatomy. It involves passing a catheter from one of the larger arteries of your body, most commonly the femoral artery site. And the catheter is passed up under X-ray control using a very soft floppy wire for safety. And the catheter is positioned just outside and then into the origin of the major coronary arteries. An X-ray contrast material is injected into the arteries, at the same time filmed or recorded digitally on our system to define the anatomy.
Not all patients require a coronary angiogram, but many do. There are more than 1 million coronary angiograms performed in the U.S. each year. How aggressively the patient will be treated really depends on his or her risk for heart attack or sudden death. Now, as you know, Perry, once the heart muscle is damaged, that damage can't be reversed.
And that damage can have lasting consequences,
which should be taken very seriously.
Julie, you're so right. What we have to understand is that treating heart disease is not doing bypass surgery or angioplasty. Treating heart disease is preventing it.
Absolutely.
Thanks. We'll see how doctors get blood flowing to the heart after today's Healthy Body, Healthy Mind Q&A. What's the most common time of the day for a heart attack to occur? A, 6 p.m. to midnight, B, 11 a.m. to 5 p.m., or C, 4 a.m. to 10 a.m.? Answer C. Heart attacks frequently occur from 4 a.m. to 10 a.m. due to higher adrenal amounts released from the adrenal glands in the morning hours. Increased adrenaline in the bloodstream can contribute to plaque rupture. For more health-related information, visit our website at healthybodyhealthymind.com. Once chest pain becomes severe or doctors suspect a blockage for any other reason, it's vital they get blood flowing to the heart right away. Carlos Bain has more on that.
Jerry Laxon couldn't understand why she wasn't able to exercise the way she always had in the past. She didn't have any risk factors, and she had been to 3 other doctors who told her that the chest discomfort could not be her heart. But an exercise stress test, utilizing an ultrasound picture of her heart's motion, said otherwise.
I started the stress test, and it was the Doppler stress, and I was 2 minutes into it, and they called it. And the fellow watching the EKG pattern, and then the other person watching what I would call something looks like an ultrasound, basically called it. And I remember exactly what he said. He said, "Honey, you have heart disease."
Jerry consented to having a coronary angiogram, and doctors found a blockage. Her doctors performed an angioplasty procedure, in which a balloon-tipped catheter is positioned inside the blocked artery, and by inflating the balloon, the artery is dilated back to its original size. Once dilated, a tiny spring-like device called a stent is placed inside the artery to keep it from re-narrowing.
The balloon is filled with fluid that you can actually see expand, and that forces the plaque aside and makes room for blood flow. Now, coronary angioplasty has basically changed since 1993 with the advent of stents. Most people now undergo not just coronary angioplasty, but coronary artery intervention, which could include not only just balloon angioplasty, but also stent treatment.
The pain which Jerry had been experiencing disappeared immediately.
Quite frankly, on that Thursday, because I was, again, expecting company, I came home and cleaned my house. Now, that's the truth. And I thought, they might not like this. And I thought, I didn't have a heart attack. You know, the stent's in place. I didn't have a heart attack. Go ahead, clean your house.
The portion of the artery where the stent is placed can re-narrow, especially if they are placed in small arteries. The rate of re-narrowing with conventional stents is anywhere from 10 to 30%. Re-narrowing usually occurs within the first 6 months after the procedure. One attempt to keep this from happening involves using stents that contain a drug that is released in the artery to keep it from re-narrowing.
With the advent of and the wide use of drug-coated stents, drug-eluting stents, the likelihood that a patient will have bypass surgery probably has gone down, because we're using drug-coated stents a bit more now, with the understanding that if it goes in successfully with a good result, we have a much better likelihood that the artery will stay open.
Placing a stent in an artery is not always possible, either because the coronary insufficiency may result from too many small arteries that are blocked rather than a narrowing at one place, or because of the nature of the narrowing. In that case, coronary bypass surgery may be recommended. The operation uses a vein from the patient's leg to bypass the blocked portion of the coronary artery and restore blood flow. The procedure is performed around 750,000 times a year in the U.S. Robert Leggett had bypass surgery a year ago, and it not only saved his life, it changed it.
It's a wake-up call, because if you don't change, your arteries will become hardened, more clogged, and you'll be able to do less and less exercise. I love to be outside, and like I said, I love life.
His personal trainer and frequent walking buddy noticed a major change in him since the surgery.
It's given him a whole new outlook on life. It's made him smile a lot more, I think. He's just a very happy person.
Patients with coronary artery disease should be closely monitored once they begin an exercise program. It's important they begin physical activity slowly at first.
Absolutely, Carlos. The last thing you want to do is push your heart too far too fast.
And some patients may be tempted to get started right away.
They are tempted, but they need to check with their doctor first before doing any sort of exercise.
An excellent point.
Thank you. But a supervised cardiac rehab program can be one of the best ways to help patients get their lives back after a heart attack. Jerry Laxon is anxious to get back to her exercise routine. But since she recently had coronary artery problems, she knows she has to start slowly and be watched closely by health professionals.
Very good. A little high.
She's begun a 12-week cardiac rehabilitation program supervised by cardiologist Richard Luker.
We have to be very careful that we're prescribing the right amount of exercise for that person's ability based upon their age, their weight, their sex, and how much heart disease they've had in the past. So we plug an exercise prescription at a level of physical activity that is a certain percentage of their maximum heart rate or blood pressure. So we're always careful to keep them at a level of activity that's safe.
For her part, Jerry loves getting back into exercising, and because it's a supervised program, she doesn't have any fears about working out.
I have monitored exercise, and that's very important to me because that gives me the confidence to sweat again. Today's the first time I got to sweat a little bit, because they haven't been letting me do that. To be able, because I want to be able to hike to the top of the mountain again.
How are you feeling? Good. Good.
During the early rehabilitation period, a patient's exercise is monitored to assess a level of exertion. They are also educated about why they have the disease and what they can do to prevent further problems. That education includes proper nutrition, weight management, and emotional support.
These are the doors that heart disease came into in your life. It was elevated blood pressure, smoking, stress, cholesterol, etc. You can close those doors so that it doesn't keep coming in.
Preventing future problems often means medication to reduce cholesterol levels, lower blood pressure, or limit blood clotting.
That was something that wasn't easy to get used to, taking all this medication every day, and so that's been a learning process. Take the medications. Just a couple days ago. I've been doing pretty good. It's helped me, and I can tell the difference in how I feel.
Robert Leggett is willing to do what's necessary to stay healthy.
This is my new challenge in life. Before it had to do with work, of finding out as an auditor what was the real story behind the figures that you were looking at. Now my big challenge is to overcome this and to live a very long and healthy life, because it is a good life. There's a lot of beauty out there.
And Jerry Laxon has advice for anyone who's experiencing symptoms but doesn't want to think it's heart disease.
Take charge of your own health, whether it's heart disease, cancer, or anything else. If you feel like there's something wrong and you feel like people are just not quite getting to the bottom of it, even if they're well-intentioned, if something tells you to keep going further than the next step, go.
For patients who have coronary artery disease, whether it was an acute coronary syndrome, a heart attack, or who've managed to avoid any damage by having an angioplasty or surgery, there is every opportunity to have a long and healthy life. If they eat right, exercise 30 minutes on most days, make sure their blood pressure and cholesterol are in control, they'll have the best chance to stay healthy for many years to come. That wraps up this edition of Healthy Body, Healthy Mind. I'm Dr. Perry Kritschmar. See you next time. For more health-related information, visit our website at healthybodyhealthymind.com.